Hey guys, hello. Today I'm going to be doing some MA exam prep, okay, some certification prep. So this video is for you if you are preparing for certification exams like the CCMA, the RMA, the CMA, AAMA, also NCCT. So if you're taking any of those exams, just remember that each certification exam, they ask the same type of questions, okay? And so I create practice questions that are going to be asked on all of the exams because, as I always say, there are certain things that you need to know as a medical assistant. And so that's why all of the certification exams, they ask the same type of questions. So do me a favor as you are coming in to watch this video, just let me know down below where you are watching from, what city and state, and also let me know where you are in your journey, okay? And if you happen to have any questions, you can put them in the comment section and I'll get to them as quickly as I can. I'm not going to be long in this video. I just want to go through a few. Somebody asked me if I could do another certification prep, an updated one. And I said, I'll try this weekend. I had some time this morning to create a presentation. So let's go ahead and get into it. Okay. So just let me know down below where you are watching from and what your current status is. Okay. So for any of you that may be new to my channel, new to me, my name is Kendra, aka Miss K. My students gave me that name, the nickname Miss K. I became an MA in 2004 and I became an MA instructor in 2011. So I've been teaching a long time. Part of what I do also is exam prep and consulting. I work with different schools to help their students get prepared for certification. And I also help consult with curriculum for medical assistant programs as well, and just ways that they can make the program better. Then I'm also an entrepreneur and creator. Okay. So many of you guys already know I have an MA refresher course. This study guide is for anybody who is preparing for certain people who never went to school for medical assistant, but they had the experience. And so this course also helps you get prepared for that. And then also do me a favor and just confirm down below that you can hear me. I accidentally went live one time and I was on mute the entire time. So just confirm you can hear me as well. And then I also have an ebook. Both of these are linked down below. Okay. They will be linked below this video. But I have an ebook as well. So I mentioned that in addition to being an MA instructor, I'm also an entrepreneur. I have several businesses. And one of the things that I do, I help other people start a business as well. So I wanted to make sure I created something specifically for medical assistants and also, nurses. I've had nurses buy this ebook as well because it just teaches you how to use your clinical skills and turn that into entrepreneurship. Okay. And I'm not even getting into that. I was about to tell you how much I made in my business, but I'll save that for another video. I actually invited you guys to my other YouTube channel. So you can just kind of get more of the business aspect of things. But anyway, I teach you guys how to make money outside of medical assistant as well. Okay. But let's get into it. First question, which principle of ethics refers to fair and equal treatment? Autonomy, non-maleficence, beneficence, or justice? Which principle of ethics refers to fair and equal treatment? And for anybody that's joining for the first time, how I do things here, I will read the question and then I will just give you guys a few seconds to put your answers in the chat before I go on to the next question. So let me know what principle of ethics. And as you guys are going through these questions, make sure anything that you don't know, you add it to your notes. Okay. Make sure that's one of the ways you study is making sure you are adding to your notes as you come across things that you didn't know. Okay. So if you chose justice, that is correct. The principle of ethics that refer to fair and equal treatment is justice. So make sure you know these principles. Autonomy refers to being able to make decisions on your own. Non-maleficence refers to doing no harm, and then beneficence is referring to doing good. Which schedule of controlled substances do not allow refills? Which schedule of controlled substances? Make sure you guys are familiar with your schedule of drugs. Okay, you got 5 schedules: schedule 1, 2, 3, 4, and 5. Which of those schedules do not allow refills. I'll give you guys a couple seconds to put the answer in the chat. Okay, if you say Schedule 2, you are correct. Now, Schedule 1 is not accepted for medical use at all, so remember that. Schedule 1 is like your heroin and LSD, those drugs that are not accepted for medical use at all. And then Schedule 2 has a very high potential, but they are accepted for medical use. So if you're not familiar with the schedule of drugs, make sure you get familiar. Which administration route places medication between the cheek and gums? Which administration route places medication between the cheek and gums? Now, I'm doing a mix between open-ended and multiple choice because I really want you guys to make sure you can answer open-ended questions. That's one of the best ways to study. I always mention, if you ever watch my study tip videos, is make sure you can answer open-ended questions, because if you can, then you know the information. If you don't need to see options for the answer and you just know it outright, that's how you really know that you know it. So you'll see a lot of open-ended questions in my study videos. Okay, if you said buccal, you are correct. That's between the cheek and gums. For informed consent, which of the following is the responsibility of an MA? Explaining the risk of the procedure, offering alternative procedures, verifying insurance coverage, or explaining why the procedure is necessary. Which of the following, and you can just put the letter A, B, C, or D, which of the following is the responsibility or actually within the scope of a medical assistant? Okay. If you chose C, you are correct. So, as medical assistants, we don't get into the risk and alternatives. That is the provider's responsibility, and also explain why the procedure is necessary. So, remember, as an MA, we cannot advise, we cannot diagnose. Now, and I will say this, we can repeat instructions. So, if the provider asks you to, the provider may have already talked to the patient about the procedure, and then you may have to reinforce those instructions, or you may have to remind the patient, like, hey, according to the provider, these are the risks, these are, this is why it's necessary, but you're only reinforcing what the provider already gave the patient. But in general, it is outside of the medical assistance scope. But we can verify insurance coverage. So as a medical assistant, you may be responsible for doing what's called pre-certifications, where you have to call the insurance company and you have to get permission and make sure that it's actually covered by the insurance. In which quadrant is the stomach located? And I do see some in the comments that somebody asks, is morphine Schedule 2? Yes. And so, guys, I wanted to make sure I answered that because of the question that we just had about scheduled drugs. But if you guys have any other questions, you guys can just ask it in the comment section, and I will get to those questions later. Which quadrant is located? In which quadrant is the stomach located? So if you said left upper quadrant, LUQ, you are correct. The left upper quadrant. And so this is very important, guys. Make sure you're familiar with your abdominal area and which quadrant those organs are located in. And which quadrant is the descending colon located? Which quadrant is that? If you chose lower left, you're correct. LLQ, you are correct. And which quadrant is the appendix located? And which quadrant is the appendix located? If you said right lower quadrant, you are correct. The appendix is located in the right lower quadrant. And then The gallbladder. In which quadrant is the gallbladder located? The gallbladder. Give you guys a couple seconds on that one. Okay, if you said right upper quadrant for the gallbladder, you are correct. RUQ, right upper quadrant. So make sure you guys, especially if you just struggled as we were going through these and you got some incorrect as you were watching it, just make sure you study the quadrants, okay? How often should an MA verify patient's medication? How often should you go over your patient's medications? Give you guys a couple seconds. If you said at every visit, you are absolutely correct. I think I shared with you guys before. I had a patient who was literally seen like from one day to another, or maybe one week. I can't remember. I know it was like a couple of days. It was very close, but she had just been at her primary care office that morning before she came to see us. I work in cardiology. She had just went to a primary care and her medication had changed. And so that's how quickly it can change. So I know sometimes you may think, oh, the patient was just here even yesterday or a couple days ago, but you always want to still verify. And I know it can take time if your patient has a lot of medications, but you want to make sure you verify at each visit, even allergies. So I know I shared with you guys before about how I had a patient and I was verifying her allergies, and it was a blood pressure medication. And I remember I said, I'm just verifying you're allergic to, let's just say, I think it was lisinopril, just to name one. And she was like, I'm not allergic to that. I just don't like taking it. And they had it as an allergy. So I just fixed it. I made a note that patient is not actually allergic to it. She just didn't like taking it. So just be mindful of that as well. So medications, you want to verify those, and also allergies. Make sure you're going over those to make sure it is listed correctly, because sometimes it's not even an allergy. Sometimes it could be an intolerance. And then sometimes it could be just a contradiction, like meaning because the patient is on one medication, they can't take another. So just make sure you are listing them correctly. In which part of the medical record do you document a patient's lifestyle? Which part of the medical record are you documenting a patient's lifestyle? I'll wait a couple minutes. Oh, wow, Jacqueline, I'm sorry to hear that she said her dad had a bad allergic reaction to lisinopril. Wow, sorry about that. He ended up in ICU. Okay, I see you guys putting the answer in. If you said social, and I did not mean to have that question mark there, let me fix that. Well, I'll leave it for now. But social history, that should not be a question mark. But yes, social history. So lifestyle habits, as in whether they smoke or drink, exercise. Also, depending on where you work, you may have to get you may have to ask about sexual orientation. Also, their employment is listed there as well. So you may see employment and demographic information as well as social history. So don't worry, you won't ever have to choose between the two when it comes to employment, because employment can go in either section, to be honest. All right. So let's look at this picture here. So for some questions, you may actually see a picture of an EKG and you have to maybe name the artifact that's being shown, or maybe you have to name the rhythm. And sometimes in the question, you may not see a picture, but it may describe the artifact. But in this case, we have a picture here. So does anybody know what this artifact is? Looking at the picture, do you know the name of the artifact? If you said wandering baseline, you are correct. Now, wandering baseline is kind of easy to recognize because you see how it's going into the margins of the paper. Like it looks like it's wandering away. Like think about what it means to wander away. And that's exactly what that tracing is doing in the picture. Okay. So just remember, sometimes you may have a picture of the actual tracing, and then sometimes they may just describe what's happening, and you'll have to know that. Like for an example, with this question here, which artifact can result from electrodes falling off the patient or from a broken wire? Somatic terror, interrupted baseline, wandering baseline, or AC interference? Glad to have you here, Andrea. She said this is her first time catching a live, and this format is really helpful. This is why I do this. I try to mix it between both open-ended and multiple choice, primarily open-ended, because I feel like it's the best. Well, not even feel like, I know it's the best way, because it makes you, it forces you to know the information. And one of the things I don't want anybody to do is to get caught up in the questions. I want you guys to always be able to answer open-ended questions. So thank you for sharing that. Okay, so this is going to be interrupted baselines. Now, again, you may see a picture. If you see a picture of an interrupted baseline, that's another one that's kind of easy, because think about what something means to be interrupted. So the tracing, there'll actually be an interruption. So you'll see a break actually in the tracing. You'll see the tracing, and it'll stop, and then it'll continue on, and then um it may be described like it is in this question here. It may say, which artifact is, the cause of electrodes falling off, or the wires being broken, and that's going to be an interrupted. So somatic tremor or somatic tear, that's going to be, and you know what? Let me actually fix this here. You guys know I'm like really big on, I don't even know why I put tear here. That should be tremor. Let me fix this right here. Let me go to this. Somatic terror is actually a thing too. But this is what it's going to be. That's probably why I actually put somatic terror, but it should be tremor. Happen when you live. But that's often from patients. Maybe a patient with Parkinson's disease. You may see that with that, and then in that case, if your patient has like involuntary movement because of something like Parkinson's disease, you can place their hands under their bottom to keep them still. And then wandering baseline, we just saw that one. And then a lot of times that can happen. Wandering can be the result of the patient sweating, or maybe they have on lotion. And this is why I work in cardiology. So I usually ask patients, do you have on lotion? And I just clean them with alcohol before I wipe them. And then we have alcohol, and then we have actually it is EKG prep. We have that as well. They're like little alcohol pads, but it's EKG prep that we can use to prepare the skin as well, because that can cause a wandering baseline. And an AC interference, that's usually from something in the area. Could be a phone, could be something electrical in the area. At what age is the first dose of the HPV vaccine recommended? What age is the first dose of HPV recommended? I'll give you guys a moment to answer that. Okay, 11 to 12 years old. Okay, 11 to 12 years old. Which part of a soap note should an MA record a patient's vital signs? Which part of a soap note should an MA record a patient's vital signs? So for those of you saying 9, so technically you guys aren't incorrect, because some providers will begin giving HPV vaccines as young as 9 years old. But 11 to 12 is the answer according to certification. So which part of a soap note should an MA record a patient's vital sign? If you put objective, you are correct. So remember your parts of your SOAP note, guys. So subjective, that's where your patient's symptoms goes. That's where the chief complaints. So whatever your patients tell you, that's subjective. Of course, objective is whatever you can see or measure, like vital signs. And then assessment is the provider's assessment of the patient, like the diagnosis or what they feel might be happening or going on, or what they feel the diagnosis might be. And then the plan is whatever the provider plans to do. See the patient back in 2 weeks, lab work, sending medications to the pharmacy, things like that. At what angle is a subcutaneous injection given? And do me a favor, guys, if as you're watching this, if this video is helpful, go ahead and like the video, exit the chat and like the video. It helps it to get out to more people. What angle is subcutaneous injection given? If you chose 45, you are correct. Which active listening technique involves having the patient repeat what they're saying to ensure you heard them correctly? So, which active listening technique involves having the patient repeat what they're saying? So, you ask the patient to say it one more time in a different way because you want to just make sure you heard them correctly. And this is, of course, when you are doing patient intake. You might have to ask the patient to say it again differently to make sure you heard them correctly. Which active listening technique is that? If you say clarification, you are correct. That is when you ask the patient to just, can you say that just one more time? I just want to make sure I'm hearing you correctly. I just want to make sure I understand you. And then which active listening technique involves telling the patient what you think they're saying? So in the first one, we ask a patient to repeat themselves in a different way. Now this time you are asking the patient what they think you're asking the patient, well, you're telling the patient what they think that you're saying. So it sounds like you're saying every time you take Motrin, your stomach hurts, or, every time when you take this certain medication, this happens, or whatever they're saying. You're telling them what you think they're saying. If you say paraphrasing, that is correct. So make sure you guys know those active listening techniques. So paraphrasing is when you tell the patient what you think they're saying. Clarification is when you get them to repeat it. And then you might see reflection, and reflection is when you demonstrate to the patient that you understand their thoughts and feelings. Okay, that's reflection. And then summarizing is when you repeat back to the patient, it's summarizing and paraphrasing can kind of get confusing, but paraphrasing, remember, you're telling the patient what they think, what you think they're saying, and then with summarizing, you're actually summarizing everything that the patient said to you. You're repeating everything that they said to you. All right, which of the following must be given to a new patient? CMS 1500 claim form, an EOB, an MPP, or release of information form. A claim form, explanation of benefits, notice of privacy practices, or release of information. And you can just put the letter in the chat. A, B, C, or D. Okay, I see your answers coming in. If you chose C, you're correct. So remember, claim forms, we don't give that to a patient at all. That's what we use to get paid from the insurance company. The EOB, that comes from the insurance company, and it goes to the patient to show the patient what was paid, what part of the deductible was paid out. It's in some of these terms, it explains exactly what the meaning is. So explanation of benefits, it explains the benefits to the patient, and it goes directly to the patient from the insurance company. And then notice of privacy practices, we give that to the patient because we want them to know and how we're using their information. We want to ensure them that their information is private. And then a release of information form is what they sign so we can obtain their medical records from their previous provider, or they sign it so we can release it to another provider or to them or to somebody else. No need to be sorry. So as we're going through this, if you happen to get an answer wrong in the chat, it is perfectly okay. This is why we do this, because I want to make sure you guys get the information. So it's okay. No need to be sorry. How should an MA prevent contamination of a sterile field? Reach across the sterile field, set up items in the center of the field, place non-sterile items in the center, or keep sterile items below the waistline. A, B, C, or D. If you said B, you're correct. So we definitely don't want to reach across it. So remember, we don't reach across it. Non-sterile items, we can immediately exit that out because nothing that is non-sterile should be in the sterile field at all. And then keep sterile items below waistline is wrong because we want to keep it above waistline and always in our sight. Anytime something is out of our sight, we have to assume that it is non-sterile. At what angle is an intradermal injection given? Intradermal injection. Congratulations on passing, Gordon C. Oh, you got my study guide. Oh, awesome. Okay, Gordon C says they got my study guide as well. Thank you. I'm glad it was helpful. All right, if you said 15 degrees, you are correct. Which part of Medicare covers durable medical equipment? A, B, C, or D? Which part of Medicare covers durable medical equipment, or DME? Make sure you know those parts of Medicare. Well, everything that I show you guys, you got to know. So I say that a lot. Make sure you know this, make sure you know that. But everything I'm showing you, you need to make sure you know. Okay. All right. If you put part B, you are correct. So A, B, C, and D. Remember, A is inpatient, B is outpatient. Okay. B is medical coverage. And then C is a mixture of both A and B benefits. That's Medicare Advantage. And then D, remember D for drugs. That's medication coverage. Which cleaning technique reduces microorganisms to a safe level? Which cleaning technique reduces microorganisms to a safe level? If you said sanitization, you are correct. Make sure you guys know the difference between sanitization, which is reducing to a safe level, and then you got disinfectant, which is killing pathogens and rendering them ineffective or inactive. And then you got sterilization, which is the complete destruction of microorganisms. In what stage of grief might a terminally ill patient make lifestyle changes to give themselves more time to live? So the stages of grief. Now, in this stage, and it's 5 stages in this stage, a terminally ill patient, they're trying to make lifestyle changes. They found out that they don't have long to live. And so they're trying to make lifestyle changes in hopes of giving themselves more time. Most people get them mixed up. Somebody said I get them mixed up. Yeah, most people do. So just make sure, and for anybody that knows you struggle with those cleaning techniques, just make sure you study those and make sure you add it to your notes. So that way, when you see it on a test, you'll know it. Okay, and what stage of grief? In this case, the patient is terminally ill. and they are trying to make lifestyle changes in hopes of giving themselves more time to live. I see those answers coming in, and you guys are correct. Bargaining. So, in a bargaining stage, a patient is, they may find out they have 6 months to live, and so they say, well, maybe if I start eating right, maybe if I stop smoking, I can give myself more time, and that is that bargaining stage. And then, in what stage of grief might a terminally ill patient blame their provider for their illness? So in this stage, the patient might blame the provider for their illness. What stage is that? Okay, if you said anger, you are correct. So the 5 stages of grief, you have denial. Now, in that stage, a patient may choose not to believe there. And the stages of grief, it refers to actually loss, like losing someone. And then also stages of grief, when it comes to a patient finding out they have a terminal illness, So denial is that first stage of being in disbelief, refusing to believe it. And then you have anger, where they may want to blame the provider. They get angry, maybe even at themselves. And then you have bargaining, where, as I mentioned, the patient is trying to give themselves more time. They want to ask, even they maybe even pray and ask God to turn it around and heal them. Um, and then you have depression, and then you have acceptance. Okay, so make sure I use the acronym DABDA, DABDA, for denial, anger, bargaining, depression, and then acceptance. Okay. So, guys, this is going to be it for now. And I told you guys I wouldn't keep you long. So just remember, if you need some more help, you can get my study guide at inmaterefreshercourse.com. It's linked below. Make sure you like the video if this was helpful, and also comment in the comment section. I know some of you guys are writing in the chat, but you can also comment in the comment section as well. Thank you guys for chiming in and hanging with me on a Saturday afternoon. I hope you guys enjoy the rest of your day. I don't know if you guys got snow last week, but I'm in DC. We got it real bad. I'm still stuck in the house. It is iced outside. I can't even go to my mailbox. That's how bad it is outside. So I'm still stuck in the house. So thank you guys again. I had a little bit of time today, so I said, let me get on here. But I hope you guys enjoyed this, and make sure you like the video if you did.